Welcome. Welcome to an episode of From the Pure Land. Excuse the little shaving blemish I've got on my lip. I hope it's not distracting. Another interview today, and this is the second time I'll be interviewing. We're really having a discussion with Dominique Side. She's the author of Discovering Buddhism. She's got her Substack blog is The Softer Gaze. She's been practicing Buddhism since her early 20s, and has a new book coming out this summer called A New Way of Seeing. She has a PhD in Madhyamaka Buddhist philosophy. That's the middle way that's associated with Nagarjuna. And we're going to talk today. She's written in her blog, she's been very open and to sharing her experience with a recent bout of surgery for a malignancy. And we'll let her describe that better. But I've admired how her honesty in describing the process of dealing with that from the a Buddhist background, from someone who I think is living the Dharma. And so we will discuss that, the role of the Dharma in dealing with traumas. And as we were talking before we started, we realized that we both have books coming out. Hers is called A New Way of Being, A New Way of Seeing, A New Way of Seeing. Mine is called The New Middle Way. And they're sort of approaching the same kind of things. It's relevant to how one uses the Dharma in one's life. So I will ask Dominique to begin with that and anything else, talking a little bit about her book and anything else she'd like to say before we start talking about traumas and illnesses.
So thank you so much, Mel. It's a pleasure to see you again and to speak with you again. And I hope our discussion is as interesting as it was last time. I certainly really enjoyed it last time. So I have another book coming out this summer. It's been several years in the making, and it's based on what's called the Buddhist Abhidharma, which is the philosophy, the basic philosophy of Buddhism. The sorts of principles that people will have heard of, like what's called the three marks of existence, which is impermanence and suffering and no self, the Four Noble Truths. These basic principles of Buddhism that are common in all traditions in one way or another. And the reason why I'm revisiting them is that I'm not simply presenting them in an academic way, or even in just a simply straightforward, narrative way. I'm showing how challenging they are for Westerners who've been brought up with a completely different way of seeing things. And so even though we hear about the Four Noble Truths, for example, all Buddhists will have heard of those, and we know about them, and we will have spent some time thinking about them. But have we, to take them on board, really, I find, means it's quite earth-shattering. It completely changes your priorities, how you interpret situations like illness and trauma, as we just mentioned. Suffering is the first of the Four Noble Truths. So how you understand all experiences of suffering, what you do with them, how you analyze the causes, and what sort of prospect you have of improving your life and how you understand what that might mean, and what that might look like. Of course, improving your life in a material way, we understand that, but improving your life spiritually, what does that actually look like from a Buddhist point of view? But because, of course, there are many, many different traditions talking about this. So specifically, we talk about nirvana, we talk about liberation. What does that really mean? And how does it manifest, in your life? And how do you know whether you're going in the right direction or not? So, um, so basically, it's a book which hopefully revisits a lot of things that Buddhists will be familiar with, but really encourages them to look at them more deeply, to try and see what they mean and what they imply to us, in the present time. And in other words, how you can apply that to your life. So, but because the reason I'm doing that is because I have noticed many, many Buddhists in the West are sort of what I was telling you was I call them half-baked Buddhists. They are definitely Buddhists and they're very genuine, right? They're completely genuine. There's nothing to do with motivation at all. It's simply a difficulty that we all have in this cognitive dissonance that we have with such a completely foreign and different culture, and a foreign way of seeing things and of understanding things. And it takes a little bit of an effort, just a little bit, to actually understand the meaning behind the words. So that's why I wrote the book, because I just wanted to do something with the potential of helping people digest and sort of really internalize, the teachings of the Dharma in a way that is quite difficult because of the cultural difference.
As we were talking before, I feel as though it took me about 35 years of practicing Buddhism before I really absorbed it into myself. It didn't happen all at once, but there was a huge acceleration at one point, um, which I've written about. And there was a point, maybe 25 years, not 35 years, but about 25 years into my practice. I remember, and it's a story, I've told before, but I was having coffee with a friend who happens to be a Pure Land Buddhist priest, and I was about to have hip replacement surgery in a few days. This would be my fourth, one, two, three, four, fifth. This would be my fifth hip replacement.
Oh, wow.
And and my previous experience had gone terribly. I had the hospitalization from hell, and I had become pretty phobic about hospitals. And as we were having coffee, he said, well, how has your practice prepared you for the surgery that's coming up? And I realized all of a sudden the phobia wasn't there. I would go and it would happen and it would be one way or it would be the other way. And so, I mean, that's an example, that's one example, I think, and it gets to what we're talking about, uh, where illness and hospitalizations and things factor in. But that was one point where I said to myself, oh, I'm really getting this stuff. Again, it was maybe another 10 years before I think I fully absorbed it, but or almost fully. But yeah, so overall, what would you say as a Buddhist going in were the differences of experiencing? Uh, it was a fairly sudden lightning bolt of, oh, I've got cancer.
Yeah.
So, how did Buddhism, how did the Dharma prepare you for that?
So I was thinking about this a little in preparation for our talk, and I think there were two main points that came to my mind, two main ways that Buddhism helped me through. And I'm not sure which order they should come in. So I think the order is not so important. So if I just start with the understanding, Buddhism gives me an understanding, right? So as I said before, suffering comes, right? And because I'm a Buddhist, I know that suffering is part of life. I also know that there are four main sufferings that, characterize human existence, which are birth, illness, old age, and death. And whether your karma is good, middle, or bad, you always, we all go through those four in one way or another to some degree. And so in that respect, knowing all that sort of thing, it's not it's not that much of a surprise. Of course it was a surprise. You're right. It did come unexpectedly. I wasn't expecting a cancer diagnosis at all. But at the same time, there's something in me that doesn't overreact, you know. I didn't freak out at any stage actually. And this was, I mean, as I said in my blog, the nurses who I saw at various points up to the surgery were all sort of quite astounded, that I wasn't freaking out and I wasn't crying and I wasn't anxious and I wasn't reacting in a very emotional way at all. And they're trained to deal with people who do react that way. Um, and in a way, I can't really explain. I mean, it happens, I didn't decide not to react. So it's partly about understanding that these things happen, and okay, it's happening to me now, and so how am I going to deal with it? But without making it a huge deal. So that's one way. The other way, the other sort of part of Buddhism that I think definitely helped me prepare me was simply meditation practice and the different Vajrayana practices that I've been doing. So you can't put your finger on it. You can't say it's because I meditated in that sort of way and in that year that the result comes. I can't say that. But what I can say is I'm sure that years and years of meditation practice led to me not overreacting because my mind and my whole emotional makeup is a bit more tamed, as they say, a bit more pacified, takes things more in its stride. There's a bit more of a spacious sort of attitude to whatever happens to you in life. So I'm sure, I mean, that's the only way I can explain it, really. I'm sure that culminates in being able to face serious illness in a more equanimity, with more equanimity. And the fact that the nurses were so surprised, in a way, proves the point because most people don't meditate that much, right? Or haven't meditated for so many years. And that's not how human beings react. They do react. They do have very strong emotions. And I just didn't. They just didn't come. So as it went along, as I said in my blog, I realized that there was some sort of wanting to wriggle out of it all and trying to sort of deny that it was really happening to me. But it was not dramatic at all. And because I've been trying to cultivate mindfulness for so long, I guess I was quite aware of what I was going through as well at each stage. And so therefore I was able to address it and look at it and work with it, whatever it was. even when I could see that I was actually trying to deny the whole thing. Okay, so I saw that and then I worked with it. So like that. And so for me, I mean, I have to say, Buddhism really, really helped. I mean, really helped because otherwise, when you go through you know, what can be a very devastating illness like cancer, you know, it 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 completely destabilizes your emotional life and your mental life. And that didn't really happen to me. So I think Buddhism brings understanding and it also brings a certain attitude, right? A sort of more spacious attitude. Also, one of the things, I guess, one of the very important things that I noticed in comparison with other patients that I met was that I didn't have a crippling fear of dying. Now, this underlies, you know, all of the cancer conversations that people are having. Sometimes it's not cancer itself that they're worried about. It depends on the cancer. But sometimes it isn't. It's actually the prospect of dying, and of being in pain, of course, and of dying. And so there are lots of subtle fears underlying, you know, the whole process of healing from cancer. And to be honest, of course, I don't want to die. I, but I don't have a sort of gut-wrenching, crippling, paralyzing fear of death. And I think that also, I mean, that completely comes from Buddhism, you know, no doubt. It comes from Buddhism. And it comes from having more confidence in your Buddha nature, you know, so you're not identifying with this life, with this body, with, you know, with your social roles and all the other things we identify with. You have a sort of an inner and more subtle refuge, you know, and therefore the prospect of death is not so well, what to say, you know, it doesn't take you aback quite so much.
And as people can see, you seem fairly healthy now, and I know the outcome was
Yes.
less bad than, I mean, the outcome was as good as you might hope, given where you went in. Why don't you bring people up to date with where you are now, and again, how your practice may have been a role in that?
Yes, well, so I did have surgery at the beginning of January, and they cut out a very small cancerous polyp. And with colon surgery, what they do is they cut out a portion of the bowel and then stitch it back together again. So it's actually one of the best cancers for in terms of treatment because if as long as there aren't any complications, you actually function normally afterwards, right? So the cancer's gone, but because it was very early stage cancer, I was very, very fortunate, right? I mean, very fortunate because there are so many different details that could make things worse. Mine was very early stage and it had not spread elsewhere in my body. And therefore, what they told me was they cut it out and that was it, right? So as far as they're concerned, it's gone and it's not going to come back. And so I didn't need chemotherapy or radiotherapy. I just needed to rest and relax a lot. And slowly I'm getting back to functioning exactly the way I did before. So that is so, so fortunate, you know. I mean, because cancer is just one word, but there are so many different forms of cancer, and some have far more devastating consequences than mine did. So yes, I feel very blessed and fortunate. How did my Buddhist practice help with the outcome? I think it just simply I went into the surgery feeling very positive. And that definitely came from my practice and from other people's prayers as well. But I had no doubt in my mind that I was going to be treated, cured, that I was going to come out with it, out of it, and I was going to continue with a healthy life. I had no doubt that that was what was going to happen. And so I think that makes a difference. Even the doctors who know nothing about Buddhism actually say that if people are very depressed or fearful, the likelihood of complications from the surgery is much higher. So, so in that respect, yes, I had confidence that it would all work out. Um, and I've basically just taken it step by step since then. I get tired. I still get tired, so my body is still sort of adjusting, because they did say they consider it to be quite serious surgery. So it takes a little while, but I definitely can't complain at all. I feel I will regain my life, and slowly I am doing that right now. Yeah.
I know an orthopedist who will not perform a surgery like a hip replacement or something like that on somebody that doesn't have a good attitude about it. There's just a higher risk of failure, or no, not failure, complications maybe is the right word. Higher risk of complications. Do you, I mean, maybe it's kind of early in your process to ask you this question, but what do you think are the biggest learnings, either from a Buddhist standpoint or just a general standpoint of this past few months that you've experienced?
Well, I think there's quite a lot of learnings in the sense of like feeling very vulnerable and fragile, one's life is fragile but also really needing to take responsibility for my health going forward and stop making excuses for not doing enough exercise and not eating the right things and so forth. Really, it's in my hands. I've been given a very good deck of cards, but from now on, it's in my hands, and it is, I can definitely make a difference going forward. I think one of the big surprises for me was that, I had excellent hospital care, and one of the best teams in the country. And so, from the medical point of view, of course, it's all quite technical in a way. It's like it's about blood pressure and it's about you know scans and all the different medical procedures that they do. And they did all that very, very well. And by the time I left the hospital, they considered that their job was done, right? They had taken it out. The surgery was successful. I was clear of cancer. Goodbye, right? Because their job is done. And what I realized was that the medical system that I encountered anyway said absolutely nothing about healing. So all they talk about is treatment, right? Treatment, whatever it might be, drugs, surgery, different types of treatment. But the healing process is like some completely other dimension that didn't enter the conversation at all. And they didn't give me any advice on how to heal afterwards. As I said, they considered that their job was done. They'd done the surgery and that was it. But from my point of view, as a patient, in a way, that's where the healing starts, right? After the surgery, I wasn't, I was sleeping a lot, I wasn't normal at all. And I had to start engaging in a healing process, which the doctors weren't helping with at all. So I then had to fall back on, of course, alternative medical systems, which I do use. Like I've had acupuncture, for example, which definitely helps after surgery, sort of put your body back together again. And and Buddhist practice also for sort of feeling whole again. It's a whole process. It didn't just and it's still ongoing, I would say. And so I thought that Buddhism would have quite a lot to say about healing as opposed to medical treatment. And it could really complement the experience for people. Because if the hospitals and the doctor's surgeries just stop with the treatment, they're missing half the equation. You know, one of the things that I noticed with other patients was that their healing process was not very good for many of them. That they had their surgery, you know, but then they had all sorts of complications and their body wouldn't react in the way it was supposed to, you know, and then there was this and then there was that, you know, and it carried on and on, really complicated. And I was asking myself, so what is that about? Because the healing, how your body heals, in my experience, is beyond your control, right? How my body responds to different things, um, I, I can't determine how that happens. It's my body has its own life energy, its own life force, its own strength, and it sort of behaves, you know, accordingly. And so one of the things I thought to myself was in terms of the healing, actually you need to have many, many years of wholesome lifestyle behind you to have for your body to have all the right reflexes and all the right reactions, you know, and to be able to heal itself, because it can heal itself, but it needs quite a lot of different conditions, you know, to support it in doing that. So that was one of the big learnings, and I'm still going through that because my healing is not over yet, I would say. Um, but I was quite really sort of shocked, if you like, to realize that the medical system doesn't really even go there at all. It was really quite a surprise.
You know, it's an area that I think a lot has been written about, thought about lately about how that applies to other kinds of traumas as well. Grieving. I mean, you know, we have processes for grieving for a week or a month or something, but it can take much longer. You know, as you were talking, and I was thinking about, I've I haven't had really, well, I've had some traumatic uh, medical problems in terms of pain and things like that, but not life-jarring medical problems. I have had life-jarring traumas, and mm, in the early 1980s, so this was quite a while ago. Oh, and this is what propelled me to go out looking for a religion, looking for spiritual practice. But my uncle and aunt were shot to death, uh, and it was their son who shot them, my first cousin, whom I had grown up side by side with, and whom I loved, you know, very much as a child. We were now in our 30s. And when he was 20-ish, it became clear that he had paranoid schizophrenia. Um, and that experience of getting that phone call at midnight, Uncle Eddie and Aunt Margaret have been shot to death. What? Who? Where? You know, and oh, well, it could have been Barry who did it. And then having Barry with us for 4 or 5 days before he was arrested and confessed. Then to have Barry later hang himself in his prison cell. Um, that set me into a kind of, I call it the mother of all midlife crises. It sent me into an extended midlife crisis. But through that, I was beginning my Buddhist practice as well. And then on June 1st, 2015, this wasn't a phone call, it was a doorbell ring at 8 a.m. from the deputy sheriffs in Loudoun County, Virginia, to tell my wife and me that our son Thomas was dead. He had died in a skate, skateboarding in a skateboarding at 2 a.m. on a steep hill without a helmet after a day of drinking. And not only from my Buddhist practice, I think through life events, I was it didn't launch me on another midlife crisis. I was able to, I think I was able to be support for my wife and our remaining son and handle all that the hamster wheel of details that have to be handled in a sudden death like that. He was 29 at the time. Um, so yeah, I think that what you're talking about applies to so many areas. We say, okay, here's a death, or you came home from war,
Yes. Mhm.
and had had a sudden diagnosis that you weren't expecting. There's just a range of things that our culture anyway. I think Buddhism, I don't know whether I mean, you may have some idea whether in Eastern cultures, um, they're not as quick about stuff like, as quick to assume people get over things. I don't know, but we certainly do that in the West. Do you have any thoughts on whether there's a difference between East and West, and anything further on how Buddhism prepares one for that?
Well, I can't say that I don't know Eastern culture well enough, but I do know that, for example, within the Tibetan tradition, it was, and I think to some extent still is, a tradition to go on a pilgrimage after someone's died. And of course, one of the sort of logical arguments for that is that the merit that you gain through doing that pilgrimage, you will dedicate to that dead person for their better future life, right? So you're doing it with that in mind. But at the same time, if you go on pilgrimage in a moment of bereavement and grief, that helps you process the bereavement and the grief. You're on this journey, whatever wherever it is, you go through different things, and it's a downtime. You don't have to work. I mean, in Bhutan, you will get sort of sick leave, if you like, to go on pilgrimage after someone's died like that, because it's part of the culture. And so they will give you, a week or two or however long it is for you to do that. And I think that one of the sort of secondary benefits is the healing and the processing of the whole situation. So that's just one thing that comes to my mind, is that, in that respect, people do acknowledge that time you need time. You need time, and you need to do positive things in order to process and to turn something around and to start something new.
It reminds me that just the other day I received a Shitro empowerment, and I'm beginning to study doing that. And that's a process that's 40 some days after a death enables one to say prayers, to do meditations, to help the deceased
Yeah.
along their paths into whatever's ahead for them, for them.
Yeah. But it helps you too.
Yes, yes, yes,
It
yes.
helps you too. That's the wonderful thing about it. That's bodhicitta, isn't it? It's actually for self and others, but benefit of self and others, both at the same time. So your motivation is to do it for the other person, but it will actually benefit you as well.
Yes. Yeah, and that's one of those things about bodhicitta, which is the term for the deeply held desire to relieve suffering of all people, of all beings. Um, and one of the things about that, about bodhicitta and the practice of dedicating any merit, there's this practice in Tibetan Buddhism, especially, I would say, of after meditation or doing a prayer session or a chanting session with others, to dedicate any merit that you may have achieved, any positive karma that may have come your way, to all beings without exception. And I've heard explanations for this, that just doing that results in more good karma for you too. So,
Yeah.
with that thought, why don't we dedicate any merit we may have achieved here, and to all beings, to wish everyone a life relatively free. It's never going to be totally free, but relatively free of trauma.